Two.
Okay. Hi, my name is Ashley Wombles, and I'm doing case number 4. An athlete came in to me and said that he hurt his foot, but he hurt it first on January 4th, and he didn't go in and talk to nobody until after the game. Today at practice, he came in and he said that he stepped on another teammate's foot and inverted his foot. He wasn't able to continue practice. He did not feel comfortable performing lateral movements when we did the special test to him. He said he was tight and felt a pinching due to the swelling. His pain was a 7 out of 10 when he did the injury, and then it was a 5 out of 10 when he stopped. The athlete was swollen over the ATFL, which is the anterior talofibular ligament. He was point tender in that area. There was no other deformity besides swelling. His active range of motion was limited with inversion and eversion, which is typical for having a lateral ankle sprain. It was a 5 out of 5 out of dorsiflexion, and plantar flexion, inversion, and eversion was a 4 out of 5. For the assessments, we can say if it was a grade 1, grade 2, or a grade 3 ATFL sprain, but we said that this was just a grade 1 sprain. And then the modalities we're just going to do is just use an ice bag. The treatment goal is for lateral ankle sprain is to decrease pain and swelling and get all of the range of motion back, begin strengthening, and start with non-weight bearing activities, and provide support for the ankle. Rest, ice, and compression and elevation is the best way to just go out with your injury first, and then resting will prevent further damage. Ice will slow and reduce swelling, and have a numbing sensation to ease the pain. Compression will keep it immobile and supported, and elevate will reduce the pain and swelling. And the modality I'm going to use is an ice bag, pressed ice. And then when you're dealing with ice, you want to make sure that there's a lot of different precautions that you need to follow. When securing an ice bag, you want to make sure that you don't wrap the ankle too tight, because it can cause like neural problems. You can pinch like nerves and stuff, and also you can have cause frostbite if you don't watch and make sure that you're watching your patient thoroughly when they have the ice pack on. When you place an ice pack on someone's skin, it's going to melt the ice, which is going to make it colder, and you just want to make sure you're going to have frostbite. People also can have allergies and be hypersensitive with cold, which it could put them into shock, have hives and itching. Just watch to make sure if they have any kind of reaction, they say something. Numbing and tingling will be normal, but if it gets too painful, you want to make sure you take it off of them. The perimeters are going to be, you want to put it on for about 20 to 30 minutes on bare skin. Some people can't handle the coldness, so they might want to put like a towel down, but you're not going to have the same effect as if you would have on bare skin. Measurement of treatment success, just ask the patient how it's going for them, if it's working, if it's not. If it's not helping their injury, then you don't want to keep doing it, because you're not going to help them out with the injury at all. Then we're going to just try something different, like probably like a game ready would be good. And then why I chose this modality is because the ankle is not really like a big body part, so an ice bag is good for an ankle. It's perfect. The ice bag can compress and go around the whole ankle with the crushed ice, because crushed ice is going to be better. The athlete can also take it, ice their foot at home, so you ain't got to be in the office, like in the training room. They can just do it at home whenever they need it, or if the athletic trainer says, hey, you need to go ice your foot, you can do it. They can do it on their own. So all we're going to do is you're just going to set the bag over their foot and have it like that, and then you want to make sure that their foot is elevated, because it's going to keep the pain and swelling from coming down. Some athletes are going to want to just stay in the training room, which you don't have to wrap their foot. You can just have like that and just leave them for 20 to 30 minutes. Just make sure you're watching them. or you can wrap their foot up if they want it.